This video is an instruction on how to do Wii Fit balance board activities. I don't have a Wii Fit, so we're going to use a towel to represent the Wii Fit board. A lot of these activities are used for Wii Fit, but you can incorporate them into your rehab just by using a balance board, by using the ground, by using a foam pad. So the purpose of many of these exercises are to strengthen the hips, the ankles, and the knees. It helps facilitate balance, increases reaction times, and it helps with neuromuscular function and proprioception. So a lot of these vary, but we're going to have the patient standing and we're going to have their hips slightly flexed for this. Some of the strengthening exercises we can do are lunges. We're going to have the patient put their hand behind their head, and then they're going to lunge forward and then come back. And they can do that backwards as well. And we want to make sure that the patient's knee isn't going over the tip of their toe. Another one is single leg extension. So we're going to have the patient standing, again with the feet about hip length apart. We're going to have them balance on one leg, and then they're going to extend their hip back. Okay. The next one is sideways leg and arm lifts. So we're going to have the patient lift their arm and their leg in conjunction up to the side. Okay. We can also have the patient do single leg twists. We're going to have them balance on the one leg. We're going to have them take the hand and rotate to the opposite side. And then we can also have the patient do rowing squats. So we're going to have the patients have their hands out, and as they go down, they're going to do a low row and come back up. Again, making sure that their back stays in a proper position and that their knees don't go over their toes. To work more on the balance side, we can have them do a few other things. We can have them do imaginary soccer heading, or if you are in the ATR, you can have them do soccer heading. So we would throw the ball, at the patient or pretend like we're throwing the ball at the patient, and we're going to have them simply sit in that same position with their knees slightly flexed and pretend to head the ball. We can also do games on there that are called ski slalom and snowboard slalom. So ski slalom is when the person is standing like this, almost like they're on skis, and they're going to move anterior, posterior, left, and right to avoid objects on the screen. We have snowboard slalom, which we're going to have the patient stand sideways on the board, and we're going to have them move anterior and posterior to avoid objects. We can have the patient do a tightrope walk where they're in a tandem stance, and they have to balance left and right to avoid objects. We can also have the patient do a game of table tilt, where they're going to move their body anterior, posterior, left, right, and in a circular motion to help move a ball into a hole. We're going to have the patient do these exercises for about 20 minutes on the Wii Fit. We're going to have them, we recommend that they do it one time per day or one time every other day, and it's typically around 25 to 30 reps of each exercise. We want to make sure we monitor the hip, ankle, and foot motions to ensure proper control of all of those. And we want to make sure that the person has equal distribution over their feet so that we're not having any extra movement.